10 minutes to 1. So I haven't had a chance to go over them very well. So this may be a little tedious. I apologize. But see anybody else in the waiting area. So we'll go ahead and get started. Okay. I'll look this one up here. So again, this is 53, 54, 55 chapters. Hold on, there's something. Somebody else is coming in. Some of these don't just jump out at you. It's very minute details.
Ah.
Sorry? Oh. Everyone's unmuted, so if you don't want the group to hear something, mute yourself. There's something to do with patients receiving mucolytics or drugs, nebulizers in general. Made a mental note of it. Now I can't find it again. It was on I think it was on 956 here. I'm trying to find it again. And I apologize. It's going to be a little rough due to me not having this. Somebody else is trying to get in. Having this in enough time.
Started the review yet, or
you're working on it? Yeah, I just got this material, so I haven't had a chance to look at it. So it's going to be a little delayed effect. I apologize for that, but it's better than nothing. So, I know I saw it. I can't find it again for you. But it had to do with.
Ooh. Ow!
It had to do with the storage and the keeping of nebulizer medications. Oh, yes. So on 956, the bottom of the right column, there's some description of how to best store and yeah. In terms of the upper respiratory acting medications, page 948, 949, there's the table 54.3. What is that? I guess just know how they act. in addition to that, on 950, therapeutic actions, indicators. Um, just be familiar with that specifically, I guess, instead of trying to memorize the whole table. Also on 950, look at the box 54.4. That's the teaching or the patient education of the antihistamines. So be familiar with those. There. Talked about the categories, just the generic categories in this chapter. And I would say be familiar with the scenarios with which of the medications you would use. Not you want to blunt the cough reflex, or in a situation where you want to use a decongestant. Just be familiar with those types of scenarios. What category of drug would be your first line? Um, and on page 954, we'll talk about expectorants. Be familiar with the adverse effects. And that's on 954, left column. We talked about a mucolytic, acetylcysteine, and talked about alternative use for that. More specifically, we're going to find that. If you look on 956, the prototype of acetylcysteine, it gives you some of these have already referred to. There is one more thing about the antihistamines. The page that was in. So I'll save some time here. Okay, so on the antihistamines, 950, actually starts before that. I remember seeing it. Yeah, 948. There's a statement in there. So you see the paragraph that's highlighted, top right of the page, 948. There's a description of some of the indicators between the first and second generation antihistamines. addition to that, know which are first generation. I think we talked about some of the key ones. Let's see what the chapter. Um, um, drug list. So I'll mention them again. The first generation antihistamine to be familiar with. Metastine, diphenhydramine, meclizine, promethazine, and then second generation fexofenadine. Um, what's someone you're reading about? I think I mentioned it a little bit too about antihistamines to combat nausea, motion sickness. Obviously, you're reading where that would be, but I'm not seeing it jump out at me there. We're just going to move on from here. Oh, also antihistamines. I know I saw it too. Yeah, I want to talk to you about the therapeutic actions indicators. There's a, if you're really familiar with that paragraph or that. It's a 950. Um, let's see. Okay, on 942, table 54.2, some medications, decongestants I mentioned, be familiar with. Um, phenylephrine, oxymetazoline, and pseudoephedrine. I guess be familiar with the routes they're administered. Um, for some of the nasal uh, medications, and 943 on the left-hand column, contraindications and cautions. Know that. I know those. What are some of the contraindications. In addition to that paragraph, the page prior, 942, therapeutic action indicators on the bottom left. Be familiar, definitely that first sentence, how they act.
You got the name of the condition, so
Yes. Oh, your book, I'm sorry.
I have a different book,
Oh,
different version from my number.
oh, got you. Okay. We mentioned about the newborn respiratory distress syndrome, RDS. Let's see. That's in this chapter, the previous chapter. So we go to chapter 53, page 934, talking about respiratory distress syndrome or RDS. On the right column. Just know, I mean, it's very, like a 2-paragraph, how the pathophysiology of the RDS, and the treatment. Oh, yes. I'm looking for like a portion describing the maybe it's chapter 55, patient education and using uh, 972, that whole page. So patient education. All right, so on 962, table 55.1, there's a table there I would be more, just be familiar with the scenarios in which you would use these medications, um, particularly if significant exacerbation of asthma. What medications would you likely to use? Um, COPD. If you're doing like patient teaching with COPD, um, 961. There is the left column, like toward the bottom, because it's all one giant paragraph. Um, oh. If you look at the left column, 961, about midway down the page, there's a sentence that starts with COPD is the most often caused by chronic exposure to irritants. Just be familiar with the rest of that paragraph. Just be familiar with how it's um, some of the causes, some of the et cetera, et cetera. Just know that point from there on. Again, another example of 55.1. So it's easy. You can make it on yourself. Just know that about the guidelines of treating asthma, what medications and what circumstances you would use those medications under. Um, just just emphasize, just be familiar with the drugs on the beginning of the chapter I identified to you, and I'll go through them again as far as the xanthines, the theophylline, sympathomimetic, anticholinergics, be ipratropium, inhaled steroids, fluticasone, leukotriene receptor antagonist, montelukast, and then lung surfactant. Um, there's 3 listed. Just be familiar with those by name. Um, so on 974, it talks about inpatient education. Um, just be familiar on the left-hand column, the implementation with rationale. Just be familiar with that of when or the circumstances that you would administer this medication category. Oh, and you don't have the book. Sorry, that would be the anticholinergic. Uh, you have your tables match up in the book.
Tables match,
Okay.
it's not patient.
Okay, gotcha. Um, here we go. All right, so consideration of your xanthines or theophylline on 965, there's a box titled Patient Teaching for RP. What was RP? Oh, it's part of a critical thinking scenario, 967. I guess RP is the case study person. Um, if, if you're seeing that critical thinking scenario, um, and you go to the end, in this case it's 968, there's a patient teaching for RP, uh, discusses some of the drug interactions and other effects. Be familiar with that. We talked about that.
Case study.
Yeah, it's in 967 in this version. It's called Critical Thinking Scenario Toxic Reaction of Theophylline. There's a case study on the theophylline, and eventually there's a portion, the last portion of it has patient teaching. Um, so I mentioned the pathomimetics are so named because they um, have the same effects on the. So with that in mind, I guess those some of the effects you would see or side effects. Um, let's see how they worded this. So you have your textbook at 971, or the nursing consideration for patients receiving sympathomimetics. On the second column, it lists evaluation. You're, as the nurse, evaluating the patient's reaction or response to the medication. Be familiar with that. 50, 53 here. Know the basic anatomy of the lower airway. Going back to the chapters in a second. There's a substance in the alveoli. 931, paragraph titled Gas Exchange. I think the second sentence in the second paragraph talks about lipoprotein surfactants, just to be familiar with what the function of that substance is. In addition to 934, I referred you to the respiratory distress syndrome. Just be familiar with those other respiratory illnesses or pathology situation or conditions on that same page, COPD and cystic fibrosis. Be familiar with the key points on those. Yes. And we'll go back this way again. Upper respiratory, so 54. All right. I don't remember if we talked about this part again. So 9. There's a nursing considerations for patients receiving topical nasal decongestants. Just be familiar with some of the implementation situations. Yeah. There are 42 questions on that I have, and there might be different. Test you take is different, slightly different from the version we're covering here. One more. All right, so the antitussives. So starting on 940, but focus on 941, the nursing consideration for patients on antitussives. If you look at 941, left column, mentions implementation with rationale. Be familiar with that. That's all I have. I think there's a couple of calculation questions. Any questions on exam 7? Trying to see if nobody's speaking up, anybody's typing anything. Don't see anything. All right. Cool. So we'll move on to exam 8. This was learn together anymore. Exam 8 is 8, 9, or 8 to 12. We covered chapter wise. It was 8, 9, 11. What do we do? So we did 8, 9, 10, 11, 12. Oh, we skipped 1, 8, 10. We skipped chapter 13, but that's not a concern for this test. So 8, 9, 10, 11, 12. All right, I'm getting there myself, right? Pardon? Oh, on this test, there are 50 questions. So starting with anti-infective, in 8. All right, let's see. One second, sorry. All right.
Mr. Keener?
Yes.
Specific date for test 7 and then test 8.
7 will be Saturday, 8 Sunday. They're both this weekend.
Thank you.
Unless things have changed, that's what's on the schedule I have. So be on the lookout. Things can change. All right. Yeah, I apologize. This is the first time I'm looking at this at all. So, chapter exam 8. 1 second here. I'll just put it for you all. can't find it specifically, but mention the purpose. If you have an infection, a suspected infection, it's a just whatever. Say it's respiratory for this case, that we would start. We try to identify or assume what's the most likely cause, an anti-infective therapy, and then we would collect a culture sample for processing. What is the purpose of the culture? Why would you do that? Why would you collect it? On page 93, talking about treatment of systemic infections. The bottom left column talks about a therapeutic approach of combination therapy. Be familiar with that concept. Yeah. I hate to give you this much information. On page 94, there's um, it gives you a list of adverse reactions to anti-infective therapy. Um, just be familiar with all those subcategories: kidney damage, GI toxicity, neurotoxicity, hypersensitive reactions, and superinfections. Just be familiar with what those are.
What is that under?
I'm sorry.
What is that under?
That's in chapter 8, and it's in this version. It's page, and it's actually the last section of the chapter. It's called not a table or anything. It's just a section called Adverse Reactions to Anti-Infective Therapy. And so it has a paragraphs of each of those categories I mentioned about kidney damage, GI toxicity, neurotoxicity, hypersensitivity reactions, superinfections. Um, On page 91, left column, talking about resistance or antibiotic resistance. Just be familiar with that concept. Antibiotics, chapter 9. Um, there were two categories, main categories discussed. They were bactericidal, bacteriostatic. Just be familiar with those main categories. think that was in chapter 9. So the difference, I guess, between those two major categories. Chapter 8 still. No, it's in chapter 8, sorry. On page 90, under anti-infective activity, on that right paragraph, or right column rather, the second paragraph. Then on page 92, box 8.4, the patient and family teaching using anti-infective agents. Be familiar with that. Now I think we're in chapter 9. Regarding penicillins, 19, box 9.6, and that's patient and family teaching. Regarding penicillins, you familiar with those concepts? I'm not seeing a specific example in the book, but I would just say be familiar with presentation of a patient that you believe is having a sensitivity or anaphylactic response to a medication. What types of signs and symptoms would you see? It's not specific example I even pinpoint in the book, just types of things you would see in terms of difficulty breathing or skin rash, itching, fevers, that kind of thing. Right. I've seen this one before. So on 101, drug therapy across the lifespan, regarding children, they talk about some of the categories of antibiotics. I guess that's the second paragraph. Be to use in children with caution and precaution. Let's say not only be familiar with the categories they're talking about, but maybe some of the examples of. Um, Concept question here. I'm trying to find the example for you. We mentioned page 99, second column, talking about the categories of bacteria and select the bacteria or some antibiotic to combat that bacteria. So there's a gram-positive, gram-negative, aerobic, anaerobic. Just conceptually be familiar with that, with those identifiers. Oh, yeah, better yet, on page 101, going along with that same reading material there, you put on after they talk about the different types of bacteria. there's a paragraph that I think is too because there's no perfect antibiotic that was without effect on the human host. Be familiar with that concept in that paragraph there? Something called selective toxicity, mainly. So 1 second here. Patient teaching with the penicillins. No, you know what? Sorry, I already covered that one. Sorry. Thanks. All right. Almost like a miscellaneous category of these. 127. I tell you this, there's a anti-tuberculosis drug, and it's part of your yeah, it was something covered in the drugs. No, the isoniazid. Just be familiar with some of the nursing interventions with that. Something specific for you to look at. I guess just be familiar with the purpose of it. Not seeing it jump out at me. With the cephalosporins on 111, the right side, there's a nursing considerations for patients receiving cephalosporins. Just rationale, familiar with that. Yeah. I guess with the there's mention of, particularly the penicillins, there's some cross sensitivity to other penicillin derivatives. I'm not finding it, but I know we mentioned in the lecture. Considerations for patients receiving penicillins and penicillinase-resistant antibiotics. Under the assessment history and examination, there's a discussion. First bullet point talks about the cross sensitivity there. Um, 106. No. Hold on 1 second. Yeah, no, it's 106 on table 9.2. There's a combination drug, imipenem, cilastatin. Know the indications of using that medication. But the aminoglycosides, page 104, under adverse effects, start talking about some of the familiar with those. Particularly with the black box warning. It's taking so long. I'm just trying to find you the examples to read. Um, oh, chapter 10. Antivirals. Uh, 148. Citovir. Let me see. Oh yeah, so 148 under pharmacokinetics. Pharmacokinetics, bottom left column, bottom paragraph talks about citovir. Just be familiar with that.
What is it?
Citovir, Cidofovir. Just know that first sentence there. Be familiar. I mean, read more than the first sentence, but be familiar with that concept they're talking about there. On 151, table 10.3, bottom of the table on that page is a medication called retrobir. Just know the indications for using that drug.
Can you repeat that?
151, table 10.3, the retrobir or zidovudine. Probably butchering that up. This retrobir, what is the indications? Know the indications for using that medication? On 146, table 10.1, it's a list of antiviral agents there. Know the ones that are specific to influenza A.